Good evening, and welcome to the Cure HHT webinar series. My name is Nicole Schaefer, and I'm the Director of Professional and Medical Programs for Cure HHT. I want to welcome you to this evening's webinar, Lay Down the Law with Cure HHT, presented by Mark Beath from CRD Associates and Mary Ann Clancy from Cure HHT. Tonight's call is being recorded and will be posted on the Cure HHT website. Except for the presenters, everyone's phone or microphones have been muted during the webinar to help reduce background noise. You will notice on your control panel there is a section for handouts. Here we've attached a PDF of the HHT Congressional Fact Sheet and a list of the internet links that are mentioned throughout the webinar. You can download this to your computer at any time. These handouts will also be available on the website with the recorded version. Also on the control panel, there is a section for questions. If you have a question at any point during the presentation, please type it into the question box. There will be a 20 to 30 minute question and answer period at the end of the webinar. We ask that you keep your questions relevant to tonight's topic and general in nature so the answer will benefit everyone. Tonight we will show you how to begin a conversation with your legislative representatives to share your HHT story and ask them to support the HHT Diagnosis and Treatment Act. Now it is my pleasure to introduce our first speaker, Mark Beath. He is Senior Vice President of CRD Associates, a government relations, public policy, and strategic development firm in Washington, D.C. Mark has served as a legislative advisor for Cure HHT for the last 6 years. He's helped clients secure federal funding, build new partnerships with federal agencies, and mobilize grassroots to advocate for legislation pending in Congress. Our second speaker, Mary Ann Clancy, became the first executive director of Cure HHT in 2001. Prior to that point, Mary Ann served on the HHT Foundation Board of Directors, founded a healthcare consulting company specializing in transdermal drug delivery and oral health care, worked in national healthcare management with Oral-B Laboratories, a Gillette company, for 14 years, and held faculty positions at Forsyth Dental Center, Boston University, and Tufts University School of Dental Medicine. I now turn the program over to Mark and Mary Ann.
Thank you and good evening. A real pleasure having everybody participate in this webinar tonight. I understand we have more than 100 people participating, so I hope I get a chance to meet each and every one of you in person someday. But really the purpose of this session tonight is to give you a better understanding of the legislation that we're working on and how you can make a difference. So I'm going to get right to things, and I'm going to move relatively quickly through our presentation, but look forward to the questions later on. What I'd like to first do is give you kind of an overview of how Congress works or doesn't work at times, the current climate that's currently before us. I'm going to talk a little bit about our government relations initiatives, but primarily focusing on the HHT Diagnosis and Treatment Act. And lastly, I will walk you through how you can reach out to your members of Congress and help get this legislation signed into law someday. So let's first start with a little civics lesson here, or a refresher from your elementary school Congress Congress classes. We're going to talk a little bit about who your members of Congress are, the kind of work they do when they're in D.C. and when they're home, and talk a little bit about staff, because staff are very important folks, and that's probably who you're going to be interacting with when you reach out to your members of Congress. So just as a refresher, there are 100 senators in the U.S. Congress, 2 for each state. So everybody on this call, if you're calling from the United States of America, you are represented by 2 senators. In the House, there are 435 members of the House, so everybody has 1 U.S. representative in Congress, and each representative represents about 700,000 people. I'm going to get into how to reach these people, first of all, how you can identify who your members of Congress are, and how you set up a meeting, we're going to save that for later on in the presentation. But first I want to give you kind of an overview of what their responsibilities are. This is just a few of the functions of a member of Congress. What's probably most important to us is that every day that they're in session, they go down to the floor and vote yay or nay on legislation that's pending before Congress. They also participate in committee business. Every member of Congress is assigned to one or more committees in Congress, and we'll talk a little bit about the ones that are important to our legislative initiative. The third bullet point I have on here is probably the most important. They are there to represent you, so they need to hear from you. So a big part of their job, as well as the staff that they employ, is to hear your views directly. They also introduce legislation that they feel very passionate about, and they lend their name as co-sponsors to other bills that are introduced by other members of Congress if they support that legislation. So one of the things we will be asking these members of Congress is to co-sponsor the HHT Diagnosis and Treatment Act. They also do casework back home if you have issues with Social Security, Medicare, and other things. Let's talk a little bit about the committees that are important to Congress. In the House, it's the House Energy and Commerce Committee that focuses on health. And specifically, as you probably know, all the major committees are divided into subcommittees. There's a subcommittee on health that deals with all health policy issues coming before the House of Representatives. In the Senate, this committee has kind of a large jurisdiction. It's called the HELP Committee, but the same function as the House Energy and Commerce Committee with respect to health. And then when Congress needs to make decisions about how much money is appropriated to various health programs, that runs through what's called the Appropriations Committees. There's a House and a Senate Appropriations Committee, and they're divided into 12 subcommittees. The subcommittee that we care about that appropriates money for things like the National Institutes of Health and medical research is called the Subcommittee on Labor, Health and Human Services, and Education. Again, a very large jurisdiction of 3 departments of government, but very important to what we're trying to do. So you may be wondering, when are they in D.C. and when are they back in our home districts? This year, as everybody knows, is a presidential election year. So the schedule is somewhat compressed. This year, the House will only be in session scheduled for 111 days. The Senate is going to be in for only 150 days. They're back in their districts for periodic recess periods, but the really long ones are going to be Easter, as you can see, March through April. The summer recess is the longest one that I have seen in a long, long time. It's going to go all the way from July 16th to September 5th. Keep in mind that those last 2 weeks in July are the political conventions for nominating the president. So the Republican convention will go first, and followed by the Democratic convention. And then the elections, which are in early November, Congress is going to try to break on October 1st and not return until November 14th. So the reason I put these up is for those of you that want to try to interact with your members of Congress back in your home states, these are sort of ideal time periods for you to try to reach out to them and set up an appointment. So as you know, members of Congress are very busy, and if they are not available to meet with you, which can happen, they will defer to their staff to handle the meeting. And you should not be discouraged by that. These staff members are very good and very professional with what they do. And I'm going to talk a little bit about how congressional offices are staffed so that you understand who the right people are to talk to in a congressional office. In the Senate, the number of staff really depends on the population of the state. So as you can imagine, a California Senate office is going to have a lot more staff people than a senator from Delaware. Typically, there's only one D.C. office for each senator, and senators usually have multiple offices throughout the state to try to represent as many people as possible. In the House, it's relatively the same number of employees in each representative's office, usually about 7 to 10 employees in their Washington, D.C. office, and then they have about 5 to 10 employees back in their congressional districts. So the way it's broken down is you have a chief of staff in every office, and this applies to both the House and the Senate. Then it's divided into administrative, legislative, and communications. I really want to talk about just the administrative and legislative side of this. The person that you're going to be interacting with is called the scheduler. That's the person who, as the name would suggest, is responsible for not only the congressman's schedule, but also handles the staff schedules as well. The legislative staff, typically you have a legislative director who runs the show for the congressman, and then you have legislative assistants who report to that individual. Each legislative assistant has a portfolio of issues, and the ones that we care about are the legislative assistants that handle health care issues. And then under them you have legislative correspondents who help write the mail for the members of Congress, but they often also take meetings for members of Congress. Let's talk about the current climate this year. As I already mentioned, it's an election year. We will elect a new president. Every single member of the House is up for re-election. They're up every 2 years. And because the Senate terms are 6 years and they're staggered, about 1/3 of the Senate is up for re-election as well. Back in the fall, as you probably followed in the news, there's a new Speaker of the House named Paul Ryan from Wisconsin. He is trying to do things in a different way and trying to break some of the log jams that we have experienced here. We're under a budget agreement that was negotiated shortly before Speaker Ryan came in, and that bodes well for the process because it already sets the overall spending levels for this year, and hopefully there won't be a big fight that could lead to a government shutdown. As I already demonstrated, we have a compressed schedule, so members of Congress, when they're here in Washington, are going to be very busy trying to get some things done before they recess in July. With all the events going on in the world, of course, security and terrorism really are taking all the oxygen out of the room and are going to be a big part of what Congress does this year. And there's certainly a glimmer of hope that there will be some sense of bipartisanship. For those who saw the State of the Union speech last night, there certainly was a renewed call for such bipartisanship. But more likely, because it's an election year, we will probably see some contentious debates between Democrats and Republicans. So now that I've given you an overview of how Congress works and the climate you can anticipate, we're going to talk a little bit about the advocacy initiatives that we are currently engaged in. And I really want to spend most of my time on the HHT Diagnosis and Treatment Act. But Marianne will talk a little bit more in her presentation about some of the things we're doing with the National Institutes of Health, which is really the lead federal agency for funding medical research, as well as the Centers for Disease Control, or CDC, and the Department of Defense, which funds medical research as well. Let's talk about the bill. Why do we need this legislation? Well, as every one of you knows, going through the personal challenges that you have with this disease, it is a very difficult disease to diagnose. It's a rare disorder, so it doesn't get a lot of attention in Congress. Even though we have an infrastructure of HHT centers across the country, these centers do not receive any federal funding right now, so they're doing everything through private funding. There's also very little research funding coming out of NIH. It's really only a sprinkling of grants here and there every year for looking into the causes and possible treatments for the disorder. And there's really no coordinated federal plan to try to find a cure for HHT. Various agencies are doing little things here and there, but there's really no coordinated strategy involved in getting us to where we need to go with the disorder. So what does this bill do? It does a number of things. It's a very comprehensive piece of legislation, but I'll try to focus on what I think may be the most important, which is, first of all, it disseminates information so that healthcare providers can do a better job of diagnosing this disorder. It also does a more comprehensive survey across the country of what the prevalence is of HHT, and particularly if there's any geographic disparities. We also are going to, hopefully, through all these activities, improve early detection and screening of the disorder so that we can save lives before the strokes and other manifestations happen. And of course, it's going to advance research. We're going to plus up research at NIH to get us closer to a cause, to a cure for the disorder. What will happen when this bill is enacted, and I use the word when because I feel optimistic that someday it will. The big thing is that our HHT centers, which are already doing such great work, will now be able to compete for federal funding from a dedicated source of funding. This will allow them to reach more patients and do a higher quality level of work treating our patients. There will be much more surveillance conducted by the CDC that will help to provide more data into a centralized repository that then can be the fuel for future research that our researchers can tap into, and it will really improve the quality of the research grants that they submit to the NIH. And lastly, NIH under this bill will be required to develop a more comprehensive strategy that involves not just one or two institutes, but really several that look at every aspect of all the organ systems that are affected by the disorder. What's the status of the bill? Well, this bill has actually been around for a number of years. We have introduced this in previous Congresses, and as many of you know, when a Congress adjourns, if a bill has not been enacted into law, you have to start all over again the next year. So we did that again this year. In April, we were able to recruit some new champions for the bill. Congressman Ed Royce, who's a Republican from California. Jim Himes is a Democrat from Connecticut. So this is a bipartisan bill that they have reintroduced. We have 5 co-sponsors on the bill, which is far from what we need, and I'll talk about that a little bit more about where we're trying to go. The bill, ever since April, ever since it was introduced, has been pending before that committee that I mentioned earlier, the House Energy and Commerce Subcommittee on Health. And we're getting very close to seeking a Senate sponsor of the bill. Hopefully that will happen in the next couple weeks so that there is an identical Senate version of the bill. I'm clicking onto this link right now, which is www.congress.gov, which allows you to track the progress of this bill. And all you have to do is type in the bill number, or you can also do the name of the bill, but right now I'm going to do the bill number. And it brings up the bill, as you can see. If you click onto it, you will get a wealth of information about this legislation. This first tab that's up in front of us right now gives you a summary of the bill. This tab gives you the actual full text. It's about 14 pages, I believe. This bill shows you any actions that happen. So if this starts moving through committee, you'll see some things here. And then I'm going to skip to this tab, which is the co-sponsors of the bill. So this shows you all 5 of the co-sponsors and what dates they actually co-sponsored the bill. So this is very helpful information. I encourage you to periodically check onto that site to see how we're doing, to see how many co-sponsors in particular we are getting on the bill as we engage in this activity. So now I'm at what I think is the most important part of our presentation. How can you help? How can you make a difference? First of all, what we're trying to achieve here in the next couple of weeks is we want to grow that list of co-sponsors up to 50. And I'd really like to get up to 100 before Congress adjourns before July for its summer recess. But let's take things one step at a time. There are a number of things that you can do. We really highly encourage you to schedule a meeting with your members of Congress, and I'll go through that in just a second. If you have any kind of walks or charity events that you're involved in back in your district, it's a great awareness tool. Please invite your members of Congress to come to those events. Send an email. At the very least, send an email to your representative and your 2 senators asking them to support the bill, and we will get into that in just a second as well. And lastly, you should know that after you communicate with your members of Congress, that's not the end of the process by far. I coordinate with Roy Forey, who is an HHT patient and board member who's living here in Washington, D.C., and we go up to the Hill, meet with members of Congress, and if we have information with us about how many constituents have contacted that member of Congress, that helps us make our case and helps to encourage that member of Congress to co-sponsor the bill. So there are a couple of options for scheduling a meeting. You can either come here to Washington, D.C. and meet with either the congressman or his legislative staff, or you can meet with your member of Congress back in your home state. Again, if you end up meeting with staff, don't feel bad about that. That happens quite a bit, and it's still an effective means of communicating with your member of Congress. If you're going to come to Washington, D.C., you'll probably end up meeting with the legislative assistant that handles healthcare issues. If you do this back in your home state and you can't meet directly with the congressman, the next best person is to meet with their district director or senior staff in their district offices. So I'm going to walk you through very quickly here. First, we're going to talk about your U.S. representative. We're going to find out, maybe you don't even know who your member is in the U.S. House of Representatives. Well, if you go to www.house.gov, there's a way by entering your zip code here up in this tab, and you can find out who your member of Congress is. Because I'm from Pennsylvania, I'm going to enter a Pennsylvania zip code, 19106. Let's pretend I live there. So it gives you a nice map of your congressional district, and it shows you who represents you. It's Congressman Robert A. Brady, Bob Brady. So I'm going to click on to this link, and it hopefully will bring up his website, which it does. You'll notice that most members of Congress's websites are pretty similar. They have tabs up here that have all kinds of information about who they are and what they're doing, and it gives you contact information for how to get in touch with them. I would prefer that I think the best way to schedule a meeting is to call one of their offices. And let's just go to the Washington, D.C. office. And you can see here are the phone numbers. Call their office first. Find out who their scheduler is. Find the name of their scheduler and get that person's email address, because everything is done by email now. Sending a letter through the U.S. Postal Service is not an effective way of communicating with your member of Congress. So again, call one of these numbers and get the name and the email address of the scheduler to make the appointment. So that's how you do your House member. I should also mention that some House members split zip codes. So if you don't know who your member of Congress is and you enter your zip code and it comes up with multiple members of Congress, it will ask you to enter your zip +4. So if you can get that information, I think you can get that from your post office if necessary. So who are your senators? Remember, you have 2 senators. This is the home page for the Senate. If you click this link here, this will list all the senators alphabetically. But if you want to just jump to what your state is, go to this tab here, click State. Let's say you're from Colorado. Click this on, and you'll see your 2 senators here, Michael Bennet, Cory Gardner. Let's say you want to schedule a meeting with Senator Michael Bennet. This is his home page. And this is his contact information. Again, here's his phone number for his Denver office, if you want to call that. Again, I would encourage you to call first, get the name of the scheduler and the email address to make the appointment. So that's basically how you make an appointment. The other thing that we would like you to do, and we'd really like you to do both of these things if you can, is to send an email message. Go on record in support of this bill and make it known to their staff. When you compose your message, really the 2 most important things you can put in that message are your personal story and the ask. Tell them how you are coping with this disorder. Make it personal so that it doesn't look like a form letter. And then ask them to co-sponsor the bill. Get right to the ask. The best portal that we have been using for communicating to members of Congress is something called Popbox. And I'm going to walk you through that in just a second. By the way, all these links are included in the handouts, so you will have all these to use. This is called Popbox. This is a great website, a fun thing to play around with in your spare time. Every time there's a bill introduced in Congress, there is a page that's automatically created for that bill. And I'm going to type in the number of our bill. Again, it's HR 1849. And you will see, here's the link for the HHT Diagnosis and Treatment Act. Now this page shows you who has already communicated through PopBox to their members of Congress and what the level of support is. Thankfully, we have 100% support, 0% opposition. So I'm going to scroll down through this page, and you will see a lot of information. It shows you the status of the bill, who the main sponsor is, Congressman Ed Royce, the 5 co-sponsors. It's going to show you the text of the bill, and you can click this tab to read the full text. This is my favorite part. This is a map that shows you where all the communication is coming from to Congress in support of this bill. All these green dots represent a constituent. So as you can see, as I go to this page, you can see that there's 594 supporting. There's actually one person that opposed the bill. I'm not sure why. This shows you the organizations that have weighed in on the bill, and as you can see, Cure HHT is the only organization right now that has communicated a message on here. And then this just shows you some of the more recent messages that have been sent. As early as 3 days ago, as recent as 3 days ago, someone sent a message through this. So what this site does, say you're ready to contact your members of Congress and you want them to know that you support this bill. There's a little button down here that says support. Click that on. You don't have to have a PopBox account, so you can click no. The first thing you need to do is type your name and your contact information, because you have to verify that you are a legitimate constituent to your members of Congress. So I'm just going to put my information in here for now, just as a test. Click next. You then add, you say that you're a Mr. You add your address. It already says Washington, D.C., which is where I'm calling from. Phone number. Just going to make a fake one here. And then you click next. So this next screen will show you a sample message is already started for you. I support H.R. 1849, the HHT Diagnosis and Treatment Act, because, and then you can fill this out. I'm just going to say it will lead to a cure for this devastating disorder. But we encourage you to write a lot more than that. But for the purposes of tonight, I'm just going to make it brief. And then it gives you one last chance to preview your message and see. And then when I click this button, I'm not going to do this tonight because it would actually send it, and I've already contacted this office many times. When I click this button, though, when you click this button and use this, not only will it go to your members of Congress, but it will actually go to the legislative assistants who handle health care. This site is designed to go to the right people and not to a large spam email box. So this is one of the reasons why we use it. It's a very effective tool, and again, Roy Forey and I use this information to follow up with members of Congress to try to get them to co-sponsor the bill. So that's a basic overview of how you can send a message, and I'm really happy to answer any questions after Mary Ann's presentation, but I want to remind you that this is a compressed schedule this year, and we hope that folks on this call will act sooner rather than later, before it's too late, or we will all miss the boat. So thank you very much, and from here I'll turn things over to Mary Ann.
Thank you, Mark. Your talk has been very informative, and Cure HHT has been working with Mark in partnership to advance our goals to seek increased funding to advance our goals at the CDC and at the NIH, as Mark had identified. And I want to thank everyone who joined this call this evening, because it's very, very important for us to participate to ensure that we could advance this bill and our efforts. So this evening, what I will be discussing is our collective role. Oops, sorry, this advanced a little bit too quickly. Why is advocacy important to the HHT community? Specifically, what are our accomplishments to date? How can each of us make a difference? And what types of advocacy tools and resources are available to us through Cure HHT? So I first want to discuss NIH's funding for rare disease research. What do you mean? Sorry, we had a technical difficulty. So I first want to talk about NIH's funding of rare disease research. NIH, the National Institute of Health, is the largest funder of medical research in the world. Their budget in 2015 was $30 billion. And I'm going to share with you the 2015 funding for some diseases that you'll recognize. So if you look at the top of the screen, you will see that cancer, HIV, AIDS, Alzheimer's, Parkinson's is certainly much more common, and you see the types of funding, $5 billion in Congress just for cancer, very, very serious, very important. But I want to focus primarily on the rare disease. And basically, the overall funding was $3.6 million in 2015. And if you look at the prevalence of cystic fibrosis, muscular dystrophy, Huntington's disease, and you see the amount of funding that they have received just in 2015, you'll see that cystic fibrosis has been advocating for well over 50 years. And how that's made a difference. They've had a bill in Congress and they've had funding, federal funding for 40 years or so. Muscular dystrophy has had funding for sure over the last 25 years, and Huntington's disease. And if you'll see, HHT, our prevalence is 1 in 5,000, and we had about $2.2 million in funding in 2015. We are definitely underrepresented. And believe it or not, that's up from $500,000 just in 2012. So it's really important for us to ensure that we are talking to Congress, because it's through Congress and through legislative language and bills where funding and specifically directives are given to CDC and NIH to ensure that we're getting our piece of the pie. We absolutely must scale up our efforts. And I've been meeting in collaboration with our scientific researchers, our medical directors with NIH, and we have been getting some progress, but it really would help us through additional advocacy. Some of our accomplishments over the years as we have been advocating, we've had legislative language directing the CDC and NIH activities since 2008. We specifically had a conference that CDC paid for to basically increase early detection, talk about strategies to increase early detection, educate more medical professionals so that people could be diagnosed earlier. All the plans are set in place. We just need the funding. In 2009, we were successful in getting a congressional resolution through the U.S. House and Senate declaring June National Awareness Month for HHT. And then in 2014, we had a very targeted strategy in working with Mark and our medical and scientific directors in which we wanted to become included in the Department of Defense's program called the Peer Review Medical Research Program. And that is a pot of funding of $274 million controlled by the Department of Defense. And there are about 20 diseases included that are, if you are on this list, your scientists and your researchers and clinicians can apply for grants. The science has to be very good, and we do have very good science, but we wanted to be able to compete. And I am really thrilled to announce, and you may have seen in some of our communications, that we were added in a broader category called vascular malformations. So we now can compete, and our researchers have. About 7 people sent in grants. One is a fairly large grant that has targeted looking at how AVMs form, why they form, and what we could do to regress them using therapeutics. So our researchers will know in April whether or not which proposals got funded, if any, and we do know that the science is very strong, so we're keeping our fingers crossed. And as Mark took you through the introduction of the HHT Diagnosis and Treatment Act in 2015, and we did, as you just saw, we've had increased funding in 2015. Just 2 of our $50,000 seed grants that Cure HHT gives through your support were able to be leveraged to $3.3 million over a few years. And since 2004, since we began to fund research, we have invested as an organization $1.3 million that have been leveraged to nearly $6 million. You may have seen that this year we made our largest investment in research, which was about $230,000. And the goal here is we wanted to fund one of our researchers who wasn't funded at NIH. A lot had been cut back. And we were able to award him for his research a bridge grant until his funding came through. And then we also funded 5 young investigator grants, and the whole goal of that is to be able to ensure that we grow this community so the results of these one-year studies could then be leveraged into larger NIH grants. So that's really the key. It's really getting our researchers started through these seed grants so that they could be leveraged. And Mark and myself, as well as our scientific team, have been meeting with NIH and continuing to meet with several different institutes to talk about the importance of our research and what our teams are doing. So that is beginning to pay some dividends for us. So how can I make a difference? How can you all make a difference? Tip O'Neill from Massachusetts, was former Speaker of the House, had a famous saying that all politics is local, which is absolutely true. And so your senators and your congressmen and women work for you, and it's important that you communicate the priorities for you, your family, and your colleagues. You're all voters. Some ways of effective communication in working with Congress, from the highest to the lowest. Obviously, the most effective method of communication is a personal visit to Washington, D.C. And we've held Capitol Hill days through the years. Not everyone can come to D.C., but we've met with senators and House members about HHT, and you begin to develop a relationship with them. Not everyone could come to D.C., so the next best thing is a personal visit in their district office back home, and Mark went over the schedule, and that's also very, very effective. And then we go down the line: phone calls, emails, and you'll see petitions and mass mailing certainly not as effective. This was an example of one of our Capitol Hill days that was held in conjunction with the board meeting, and other advocates came in, and we have had a full day packed with back-to-back meetings, ensuring that we were taking our cause. So one of the first things as advocates, what each of you can do is reviewing Cure HHT materials, and specifically identifying that HHT is a national health problem. that affects 1 in 5,000 people, 60 to 70,000 Americans, and 1.4 million people worldwide. I like to call it a common rare disorder. A disorder that affects over 1 million people around the world, in my eyes, isn't exceedingly rare as some of the others that that have been recognized. And we just want a seat at the table, as other organizations have had. Due to lack of awareness, 20% of our population suffers sudden death or are disabled, and this is entirely preventable. There are few conditions through medical intervention that can stroke, brain hemorrhage, bleeding in the lung be prevented. In many devastating diseases, there is little that can be done. In HHT, through screening, diagnosis, treatment, these events can be prevented. And through this modest investment that we're asking Congress, lives are saved as well as billions of dollars of healthcare costs. It's certainly easier to treat pulmonary AVM or a brain AVM than it is for someone to have a stroke, be in a hospital for an extended period of time, or go through extensive rehabilitation. So it really is a model disorder to demonstrate healthcare savings. We have a myriad of resource materials available on our website, and I'm going to take you through, these are the links, and I'm going to take you through the website now. So you will see, you come to our legislative advocacy place on our website. You will see what I just talked about, a national healthcare problem. How can we act? The email your legislator takes you to the site. There's the PopVox site that Mark talked about here. This is our legislative fact sheet, and this primarily gives you, it's totally downloadable. You click on this, you print this. It talks a bit about what HHT is, how many people are affected, what the bill does, where AVMs and telangiectasia are. So this is more or less a sheet that could help guide you during your appointments. I'm going to take you through the other sections. So you can email your legislators here, and that will takes you to the Diagnosis and Treatment Act. And this is updated as we get new sponsors. So you see that the introducing House members were Ed Royce and Jim Himes, and so far the number of co-sponsors that we have. So there's a fact sheet here for the act itself. It summarizes what the bill does. We're asking for $5 million per year for the next 5 years. So this is all on our website as well. So what are some tips on how we can advocate effectively? As Mark mentioned, Congress can be very, very busy. So we know that if you do get an appointment with them, the appointment is usually 10 to 15 minutes in length. Don't be surprised by that. They have a lot of meetings going on with constituents throughout the day. So if it lasts longer, that's really great. But I wouldn't be a bit surprised if it ended in 15 minutes. You want to turn off your cell phone before the meeting, and you shouldn't assume that the staff has any knowledge. So you definitely want to walk them through, but walk them through clearly and be concise. Tell them up front what you want. We are asking you to co-sponsor HR 1849, and when we have a Senate number, we'll be communicating that. And you walk them through as to why that's important to you. Facts and stories to the degree that they're interested. It's really important that you tell your story, how you're affected and your family is affected. You're going to look for feedback from them and to give the staff a chance to ask you questions as well. And try to get an answer if you can right then and there. And I like to say we will only take yes for an answer. Make it very clear that you intend to follow up. And I remember when I first started going to the Hill, and I remember being, a little bit struck that we were meeting with the senator or we were meeting with the House member. But you have to be very clear that this is very important to you, and they want to know if it's important to you and that you will follow up. You must hold people accountable, and you need to understand when the meeting is over. So important further tips for follow-up. Let's say you have a meeting in the district office. You would send a thank you letter via email, which is very important. And if they say, let's say you meet with the staffer and they say, well, I really have to talk to my boss and discuss it, you want to say, okay, when's a good time to follow up with you? Is it a week? And put that date right in your calendar. And it's important for you to phone them and continue to email them. And I remember initially I was a little reticent. Am I really going to be bothering them? Am I going to be bugging them? And is that going to be I don't want to be a pest, but you must follow up. And if you have other family members, friends, colleagues, remember, they're counting votes. So if this issue is important, the more people that are helping to send in notes of why this is important and why they should be a co-sponsor, all helps. If they do agree to co-sponsor, you may want to help with re-election efforts and to make sure that they know that you're assisting. If you're attending town halls, fundraisers, you'll reintroduce yourself. And the important thing too is that these are really relationships that can be nurtured. It does make a huge difference to achieving goals. We have gone back to Capitol Hill now for 6 or 7 years, and it's really gratifying for some of our people that come in and go into a senator's office or a House member's office in Philadelphia area. I know of one specifically, and it's like old home week. They know each other, they chat all the time, and they have been sponsors and introduced the bill. So it does make a big difference if you take the time to enable those relationships and nurture those relationships, and make sure that you assist with their efforts. So I'm going to conclude before we get into questions from a quote from Margaret Mead, that never believe that a few caring people can't change the world and I'm going to say the world of HHT, for indeed that's all who ever have. So we're happy to take any questions that you have for Mark or for myself. And thank you again for attending.
Thank you, Mark and Marianne, for a very thorough overview of how to advocate for HHT in Congress. Before we begin the question and answer period, I just want to remind everyone that there is a section for handouts on your control panel, and you can download these handouts to your computer during the webinar, or they are available on our website. I also want to remind you in the control panel is a question section, and you can type your question there, and I will ask Marianne and Mark in the next few minutes. So our first question is, if I were a member of Congress, one of the questions I would ask someone would be how the monies were being spent. What types of research are the primary focus, and how much is needed to fund these by Cure HHT? Marianne, I'll let you start with that.
So money is appropriate. So this is an authorization bill that's asking for $5 million a year for 5 years. And we have specific areas within CDC and specifically within our centers of excellence for how that money would be spent. But that, in terms of, there is no direct funding that would go from the bill into NIH. But the passage of a bill, and correct me if I'm wrong, Mark, the passage of a bill, or that bill carries great weight when we are meeting with HHT. So it really, if the bill were to pass, and if we were able to secure funding, we certainly we would let our research community, we have a database of over 800 researchers in our database. And so the key is for them to be submitting proposals. Now, number one, it has to be good science, and we do have very, very good science. So there is not a direct funding mechanism that goes from the bill to NIH. Mark, your experience?
Marianne, you're absolutely correct. The bill primarily funds CDC activities and funds our HHT centers, which will provide more data to our research community so that they can submit better grants. Congress is usually, and for good reason, very reluctant to earmark money for specific disorders at the NIH. So it's very difficult to create a new HHT research program with a specific amount of dollars. In general, the way NIH works is that it's very broad, and it is peer-reviewed by other researchers and scientists, and they really encourage just the best science to rise to the top and be funded. So that's an excellent question, and I hope we answered it.
So, Mark, I will say that in the bill itself, it does call upon NIH to have a multi-institute research plan for HHT. And those are steps that we are taking now to help move that forward, correct?
That's absolutely right, Marianne. Absolutely, yes. One of the best ways to make an internal difference with NIH is to get multiple institutes involved so that they have a better understanding of what the disorder is, because there's many, many rare disorders. There's thousands of rare disorders. So by getting a coordinated research plan together, NIH will have a better understanding of what this disorder is, and it's more likely that more funding will go to the disorder.
Okay, the next question, and I'll direct this to you, Mark, first. How will this bill help educate folks in the medical field? Does it only establish more HHT centers or assist the HHT centers?
The bill could result in more HHT centers and an expansion of what we already have. But it really sets up a competitive process, and it's really going to be determined by the Secretary of Health and Human Services. But basically, the bill will allow much more interaction with clinics and other medical researchers and healthcare providers that are within a close proximity to each of the HHT centers. So that's really kind of the best way to get the information in the hands of doctors and also nurses.
So I can interject here. So the plans that I talked about, the agency that is responsible for dissemination of information is the CDC, and we meet with them regularly. And when we had our conference, there are plans where there are partnerships that would be formed with different specialty groups, with physicians that HHT people would see throughout the United States that could receive fact sheets and case studies about HHT, so it really increases our profile. It could be to the internists throughout the United States, ENTs throughout the United States, working in collaboration with the National School Nurse Association. So the goal here for education is broadly educating the medical community in a partnership with CDC. That is what they do, and they are the key organization. So that's included in this bill, would fund some of those targeted educational programs that partner with professional organizations.
Okay, thank you. The next question is asking, will there be an HHT Capitol Hill Day this year? Mary Ann?
We are still discussing that. It really depends on where we are with our introduction, how close we are to getting our Senate introduction. And Mark, we've talked briefly about this, but it really is dependent on how far we're getting with this bill.
Okay.
Yeah, I'll just add to that, Mary Ann. I think it's always great when you can have an organized Capitol Hill Day. It does have an impact. There are a lot of logistical challenges to doing that, and that's one of the reasons why we really stressed the option of meeting in your home districts with your legislators back home. In many ways, those meetings are even more effective because usually a member of Congress is more relaxed when they're in their home offices. They don't have to run to votes. They don't have to run to committee business. There's fewer distractions. But we'll certainly let you know if we do have a Capitol Hill Day organized.
Okay. The next question is, and I'm going to direct this to you, Mark. Do you have to have HHT to contact your member of Congress to support this HHT legislation?
Absolutely not, and that's a great question. Anybody can contact their members of Congress. If you have a family member, a friend, or if you're a researcher, maybe there's some researchers on this call tonight, anyone can contact their member of Congress.
And tagging on to that, how would you recommend that someone engage their community to support this bill if they don't have HHT? In particular, sort of referencing, I think one of the slides said something about petitions. You mentioned events in your area. I'm guessing school systems. There's lots of different ways of community that we all have. How would you recommend people engage their community to support this?
I'll take a first crack at this, but I think Mary Ann can answer this as well. I think social media is an excellent tool for this. So through Facebook, perhaps, would be a good way to do this. But I think if this person is interested, they should get in touch with Cure HHT, and we can probably direct you to others in your area that have this disorder. Mary Ann?
So what I've done in the past is I sent an email to myself and blind copied all my friends, anybody that I knew from my my children's friends, sports teams, anyone who I knew would be interested in and provided a link and provided the pop-box link. And if I had, so that, again, they're not getting 5 messages about this bill, they're getting 100 or they're getting 200 messages. And they actually do have people in the offices counting how many people are interested in this piece of legislation, so it makes a difference. I've done it through email, I've done it through Facebook. It just depends on your personal situation. If you want to be, if you find it more effective through email and it's a little bit more private, you could do it that way. That's what I chose to do. But the more people, and that's why I mentioned friends, extended family, this is a genetic disorder, even though there are people in many families that may sometimes deny it or don't deal with it, or colleagues. So it's all about numbers. It's a numbers game, Mark, isn't it?
Yes, Marianne, that's correct. Numbers are important, but also the quality of the communication is important. You know, we don't want to just have a postcard campaign here.
Right.
What I will say, and I worked in Congress for 14 years, if I saw a handful of letters come in about the same issue, I would pay a little bit of attention to that. But if I saw 50 personalized letters come in to the office, I would bring those to the attention of the congressman directly. And I would say, hey, there's really a movement out here for this bill. What we should really think about co-sponsoring this.
So perhaps what you could do is create a little bit of a template or some key points to include, and people could personalize it. And they could do that right on Popbox, right?
That's correct, Marianne.
And so, Marianne, who would someone follow up with at Cure HHT if they wanted to talk through some talking points, get more informational materials, or even do the follow-up that Mark mentioned, where we need to know who's contacted their member of Congress so we can go and meet them personally in D.C.?
That would be through Lauren Linhard in our office. So that would be the ideal person. She is the communications associate in our office, and I work very closely with Lauren on legislative issues, and she also works closely with Roy Forey, our board member, who is our advocate on the Hill, the man on the Hill, along with Mark. They'll be spending the day tomorrow, actually, the full day on the Hill meeting on HHT.
Well, thank you. And that will be our final question for the evening. I just want to remind everybody that Cure HHT is the cornerstone of the HHT community, advancing one common hope, to give those affected by HHT a chance for a normal life. This webinar series is just one of many ways we accomplish this mission. Please consider donating to Cure HHT to keep this initiative moving forward. You can visit our website at www.curehht.org. And I want you to remember that this webinar has been recorded and will be posted on our website under the Resource tab. After tonight's call, you will receive an email with a short survey. Please complete this so that we can better serve you in the future. Thank you to everyone who attended tonight's webinar. We truly appreciate your participation. Enjoy the rest of your evening, and good night.